Okay, so we're talking about evaluating AI tools and answering the question of how we know whether or not AI tools are actually working for the tasks we're applying to them to. So whether we're talking about, um, are they useful for short projects, for drafting things? Are they helpful for coding? A lot of the time, the evaluations of these pilot projects that we're all rolling out across the country comes down to a gut feeling. And this is something that Ali and I have talked about a lot with our work in Washington to show the value to our institutions of doing this kind of work. We need something more substantial than just, I think it feels like it's helpful. So we're going to talk today about some structured assessments that we can use to get into that those questions, get closer to answering. So the challenge for evaluating these pilots is that they're very exploratory and open-ended, and you know how do get everybody working in the same way to you know assess the models and their outputs and their performance and their own interaction and experience of using these tools in a way that can be quantified and then with some sort of validated instrument, so it's not just a string of opinions, right? So getting the formal evaluation is really important to do ahead of time. So we want you to think about core questions that have the about what the model is really doing, and not just did it do task X correctly? Did it correctly translate this language? Did it summarize the article accurately? But so when you move beyond that from your quality outputs, if it's good, was it reliable? What kind of errors occurred? Did you have to do a lot of correction and review, and how much time did that take versus the time saved by using the AI tool, right? That's a benefit. Like, does it save months of work? Does it save hours of work? Is it, does it add to your effort to correct its products? Is there monetary savings? That return on investment, that ROI, that is key for so many institutions in terms of just fiscal responsibility, right? We have limited funding for this work, and we have to be able to spend those public funds wisely, and we need to know if AI is going to help us do that better. And I think, focusing on task load and burnout and, the reduction of effort is really something that I think is under considered when it comes to understanding whether AI is a useful tool, right? The human side of using it. And that human side translates as well into the costs. Cognitive offloading, like, it's nice to be able to turn things over to AI, but like, what's the impact of that and the quality of the project or the product that you're creating? And for from a workforce and capacity building perspective, what does that impact the ability of, say, younger staff or more junior folks in their career to form the skills that they need? To know whether AI is doing your coding correctly, it helps if you have coding skills. It helps if you're a pretty good coder. So does it undermine our ability to train and build skills? And does it take away opportunities for skill development because people say, oh, sure, let's just give it to the AI, rather than having, someone learn by creating a literature review, let's say, and actually reading the materials, thinking it through, and synthesizing a response. And the monetary cost of these tools can be significant when the, cloud compute costs range into hundreds of thousands of dollars. Does that offset the cost of the other inputs that you would also have to pay for? And of course, we've spent a lot of time talking through the time we've been having this network about the environmental and ethical considerations, and they are substantial. There is an environmental impact. And does participating in the use of AI accelerate the environmental impacts that we're all going to experience sooner or later, right? And of course, the common issues of privacy and security concerns are also something to be considered, because that can be a substantial amount of work to address as well. So looking towards lighter weight frameworks for evaluating AI, the first is the NIST ARIA evaluation framework. So this is a three-part example of how you can, concretely put in an evaluation strategy to the projects that you're designing around AI. So the first here is just model testing. This is just, does the tool does it do what it claims to do? And can it accurately summarize, say, a report? Does it handle identifiable information appropriately? And does it, can you trust, it's basic functional testing. For those of you who've done system testing on the IT side of things, like this is functional testing. Red teaming it's a popular concept, but the idea is that you try to break it. You get users to hammer at it in a lot of different ways, try to get it to reveal sensitive data patterns, produce misleading outputs, and see what you can do to get the system to behave incorrectly so that you can correct that and make it stronger. And 3 is field testing. What happens when real people use it on real workflows? Does that, does it improve quality? Does documentation time go down? Like, being able to quantify the actual early days of the implementation is important, because you need to be able to sort of like look at, say, 30, 60, and 90 days in terms of utilization. Like, is it challenging for people to adapt their own workflows and behaviors to it in the beginning, and then it gets easier over time? Or is it something where it starts off easy, stays easy, people struggle with it and continue to do so? These are all things that you need to understand in terms of what the what the value is for money. Like, and that affects the kind of overall position of how you're deploying the technology. And then we have this is the impacts framework. So, while NIST tells us how to progress through an evaluation, the impacts framework tells us what to evaluate. So there are 7 dimensions to this. You can read about them in the article. We've got links at the end, and we'll put those on the shared drive and in Circle as well after the call. But so I think the ones that would probably resonate for us in our government and public health capacity is to look at integration, data modernization, and the interoperability of all of our data systems together. Like, does this fit in with that? Or is this a standalone tool that staff have to move and toggle across? And, how much does it really help workflow challenges? And acceptability, I think that this is something that I know I've had a lot of conversations around recently. There's some, if tools work well, but staff don't trust them or find them cumbersome to use, they just won't get adopted. This is, you have to have some sort of level of user acceptance, and for both technical reasons and the more societal reasons of environmental impact and bias and things that we talked about earlier. And cost, that's especially now, that's a central concern for all of us in public health, with diverse funding sources that are becoming fewer and further between occasionally. So does this have hidden costs of increasing training time or verification workflows to make sure that it's done the thing? And then so there are additional costs in terms of operational costs beyond just actual dollars. So you don't need to evaluate for every dimension on this, but pick the ones that matter most to where you are as an institution and what you're trying to do for your work, and really try to drill into that a bit. So this is kind of shifting away from the concrete measurement into how you look at the measurement of the impact on the humans who are working with your AI tools. Right? So you've got the actual AI products that matter, that's the computational outputs, but the human experience of using these tools is as important to your consideration as whether the tools themselves have utility. So this is a look at the NASA Task Load Index. It's originally derived for aviation, but I think it's pretty cool because it's very short, and it has just a few categories for mental demand, physical demand, temporal demand, like how much of your time does it take, performance, effort, and frustration, which that in a nutshell will capture a lot about what it's like to use the AI tools that you're deploying, right? So this measures perceived workload, basically, and it's validated, it's out there, it's widely used, and if you deploy it before and after you start your AI pilot or project, you can get a sense of what a baseline was and map that actual scoring to the feeling of whether or not it seems useful. Right? How do you quantify the feelings of utility? And another option for measuring human experience is looking at the mini Z. This is a burnout survey, and I snipped a piece of it here, but it's actually 2 pages. It's not super long, but this isn't the extent of it. So this is an AMA survey that they've used this. It's been validated. It's out there as well, and it's a question about tracking perception of burnout with jobs and whether, and in this context, I think it's useful to see if AI tools reduce feelings of burnout. You know, do staff feel supported by the AI products that you're bringing into your agencies and your workflows? So, you know, if it reduces, say, time spent doing work after hours, you know, people not being able to complete their work during a day, does this help with that? And so that's a measurable impact on staff well-being, which again shouldn't be discounted. You want happy, helpful, productive, staff who are able to do their jobs in the time that they're there, so they can have a life outside work, right? And to sort of bring this around to the context of our everyday work, this is how we would, consider deploying before, during, and after an AI pilot. So before, you would be looking for baseline beliefs about AI, self-efficacy, energy and engagement with your work tasks, perhaps. During the pilot, you want to assess what the tool is being used for, are staff using it, not using it, the speed of the product and doing the work, quality versus reality, like the expectations versus reality for quality. And did the implementation of an AI tool create any sort of unexpected use cases, either positive or negative? Did you find you had to redo a lot of work because of the AI outputs? So, beliefs shift, beliefs change about AI. Did the practices and implementation change over time? I think that evaluating pilots, it shouldn't stop the day the pilot wraps with a one survey, right? You should probably look at 30 and 60 days out if you're continuing to use the tool. And longer if you have the time and the bandwidth. So how do we adapt these for a public health use case? We want to have measurable indicators. So the time to complete routine tasks, say, like if a review took you a week before and you can do it in 2 hours now, are the quality, of the outputs the same? And are you seeing what you might have done yourself, or is it something different? And based on your expertise, how good is it? And off-hour system usage, again, that's a burnout protection idea. And output volume, errors and revisions, those are all things that are measurable. You can count how many changes you had to make or how many times you had to run a prompt to get it to give you output that was useful. And adoption rate and sustained usage over time, that gives you that kind of long tail of your evaluation, so you can see how things are going. And staff experience questions. I think, I've talked a lot about finding out how this works for your humans, right? Is the tool like truly valuable given their experience with it and its ability to change their cognitive workload and give them outputs? So, the lowest hanging fruit is to apply AI on common tasks and find relevant metrics to just quantify the outputs and experience of tool use. And then, at the end of that, you should be able to answer the question of like, do you trust the tool's outputs? How do you know? And what kind of value does this have for your staff at your agency? So that's a lot of me talking. So I want to get into some discussion questions. And to do that, I'm going to stop recording.